Welcome to today's press briefing. We have on the stage two doctors, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. The two doctors will give you an update on the Hospital Authority situation and COVID cases. I'll give the floor to Dr. Lau. Good afternoon. I'd like to give you an account of the Hospital Authority situation. At the moment, we have 1,515 patients in our facilities. 172 of them are new cases. For those requiring isolation facilities, there are 976 of them. 427 are now in isolation wards, 93 in second-tier isolation wards, and 456 in North Lantau Hospital, Hong Kong Infection Control Center. 136 among them are new cases. Yesterday, we received 7 more reports of patients in critical condition and 4 more patients in serious condition. Among the inpatients, 27 are in critical condition and 19 are in serious condition. 7 patients in critical condition are receiving care in the intensive care units. There are also 3 newly reported death cases. They are 2 males and 1 female, aged 76 to 94. And among the deceased, 2 of them did not receive 3 jabs. So for the 3 deceased cases, they respectively had DM, hypertension, and renal impairment, so on and so forth. And in one case, by the time the case arrived in the A&E unit, the case was unconscious, resuscitation was administered in vain, and the case passed away. And I am referring to a 94-year-old female patient and a 92-year-old male patient. So these are the 2 death cases. As of yesterday, 189 patients recovered, including 170 who were discharged from hospital. 2 patients have tested positive via hospital admission screening or examination, and 2 other residents or patients have been listed as close contact. And for HA staff, 26,330 so far have been infected, and 25,787 of them have returned to their positions. I'd like to make an announcement. The first piece of information is about infection clusters in Mong Tai Sin Hospital. And for the cardiopulmonary ward, a 94-year-old female patient who had stayed in the hospital for a while had her condition worsened quite rapidly on the 2nd of August. And because of her condition, her family members were allowed to visit her under the compassionate visit arrangements before the RAT test result were submitted. And then the patient then tested PCR positive, so did her family members. And upon investigation, the hospital found 3 more female patients testing positive. We're now investigating the link among these cases. At the moment, we're not sure about the source of infection, and we're not sure about the details of this cluster. We need to check, for example, whether other staff members are involved or other visitors are involved. All in all, we're going to test all patients and staff. For the 94-year-old elderly lady, she passed away sometime after 6 in the morning, and the case has passed on to the coroner's court for investigation. This case will be added towards the total death count, which will be announced tomorrow. Next, I'd like to remind everyone that starting today, some 50 general outpatient clinics under the Hospital Authority will make available vaccine bookings for children below the age of 6 months, and the expert advisors and the Joint Scientific Committee have scrutinized the relevant medical literature, and it is found that there are no new medical safety concerns and that a vaccine serves as an effective barrier. and there may be some mild side effects which can dissipate quite quickly, such as fever and tenderness at the site of injection. So we appeal to parents to act quickly and take the children to get jabbed as quickly as possible. And for the 4th jab, the eligibility age threshold has lowered to 50 starting today. And again, I appeal to everyone to get jabbed as quickly as possible to protect yourself as well as those around you. In light of the escalating epidemic situation, we'd like to once again appeal to the elderly population and those with chronic illnesses to be careful. Their condition, if infected, could get worse very quickly. For example, for the 2 death cases as reported today, their condition had really deteriorated very rapidly. Despite resuscitation at the A&E unit, they passed away. So if you are infected, you must make a report to us, and no matter how mild the symptoms are, you should see a doctor as quickly as possible. And after clinical consultation, if found suitable, you will be prescribed oral antiviral drugs, and you should start this treatment as quickly as possible. And once again, I remind all infected persons that there are different ways to seek medical help. You can, for example, call our hotline, or you can make a booking with the designated clinics, and there are 7 of them with the mobile app HA Go. And for the 7 designated clinics, we have dedicated hotlines for high-risk groups, such as those over the age of 70 or those below 5 years old, as well as the pregnant women. And in fact, reporters here should have received information about the 7 designated clinics, the respective hotlines. You can access our website www.ha.org.hk to have access to the relevant telephone numbers and directions if you want to have more information. Infected persons can also make a booking for teleconsultation service via the HA Go app. It is very convenient. If you use HA Go app, you can just go to this tab, make a booking, and there's an icon. You can just click this icon, and then you can make a booking with one of the designated clinics, and then you can book a session for teleconsultation. And we do hope that everyone who wishes to make a booking can do so via the app. And if you can't make a booking, you can come back later and make an appointment. Our goal is to allow every patient to make an appointment should they wish to do so. And after teleconsultation service, if prescription is required, for example, COVID-related antiviral oral drugs and other drugs for alleviating symptoms, there will be door-to-door delivery of prescriptions for patients to get treatment as quickly as possible, so as to reduce the chance of the condition getting severe and to alleviate symptoms and lower the viral load. And if members of the public wish to make an inquiry, you can call our hotline 1-836-115. If you ring us, you will be able to make inquiries about COVID-19 treatments. And if you don't have the HA Go app, and if you don't know how to use it, you can use our hotline 1-836-115 to make an appointment for consultation service. Good afternoon. We recorded 4,733 local PCR positive cases, including 1,708 PCR positive cases, and also 3,065 positive RAT cases confirmed via PCR. We also recorded 247 imported cases, including 226 PCR cases and 21 RAT positive cases. As reported by Dr. Lau, we today recorded the 3 death cases. So the total death count in the 5th wave stands at 9,314. For the 247 imported cases, 120 cases were picked up at the airport, 102 were picked up in quarantine hotels, and 25 cases were picked up after the subjects had left the hotels. The 247 cases came from 52 places, and the following countries have imported more than 10 cases: UK 47, the Philippines, and then Thailand, and Canada 13 cases, and the US 23 cases. For the remaining places, they have imported fewer than 10 cases. For residential care homes today, we have cases in 4 RCHs and 2 RCHDs. The first one, Yuan Yuan Anlo Yuan, 1 staff member infected with 12 residents and 1 other staff member subject to quarantine. Ap Lei Chau Home for the Aged, 2 staff members infected with 12 residents and 2 staff members subject to quarantine. Po Liang Kok Yam Lin Kei Lo Gui, 3 residents infected and 1 other resident will be quarantined. 松月園其太護老院其日間護理中心, 1 staff member infected with 6 residents subject to quarantine. Po Liang Kok Chang Ik Chi Center, 1 resident infected with 5 residents subject to quarantine. 利民會環翠之家, 1 resident infected and 6 other residents subject to quarantine. As for schools, today's Thursday, we have 286 schools reporting 367 positive cases. 300 students and 67 teachers were infected. These cases are from 59 kindergartens, childcare centers, 135 primary schools, 90 secondary schools, and 5 special schools. In the past 7 days, 177 schools have reported 2 or more cases to us. And today we have advised 3 schools to suspend certain classes for a week, including Sengkong Hui Yuan Zhang Hong Kam Primary School is in Taipo. Class 2E, 26 students with 3 infected. 香港神託會培恩 Kindergarten in Sai Kung, K3B, 15 students, 2 infected. 丹拿山循道學校 in Eastern District, Class 4B, 21 students, 3 infected. So for these 3 classes, they will be suspended for a week. That concludes my report. Thank you. The floor is open. Please use a mic and please introduce the media organization you represent. Questions? On the right-hand side, this lady. I'm from Now. We have recorded more than 5,000 cases today. What is your assessment of the epidemic situation? Is it an upward trend? And about the Wong Tai Sin Hospital, can you tell us more details about the visit to the elderly patient? When was the patient found positive? And what about the cases of her family members? What about the 3 other patients? Did they share the same ward? And starting today, children below the age of 3 could get jabbed. And what if the child had been infected before? Could the child get jabbed right now, or should they wait for 3 months? And according to doctors' advice, painkillers should be avoided before you send the child to get jabbed. So what is your advice for children, for parents of these children?
Maybe I would first answer the first question. So the total cases are over 5,000 now, and it's on uprise. So you can take a look at the rate published by HKU Med School. So you can also see the rate is also on the rise. But overall, the trend is still rising, and we still it hasn't peaked yet. So we have to stay on alert. And if anyone would feel unwell, so get tested and get treatment as soon as possible. So once tested positive, please report to us. And please find the HA for treatment and help. and there are teleconferencing diagnosis now, so to prevent serious or critical cases. So if you haven't got jabs, please do so. And for the situation in Wong Tai Sin Hospital, so it's in the same ward as the 94-year-old female, and it's on the 2nd of August. This particular patient conditions has quickly worsened, and we have notified her family for compassionate visit, and the family have conducted RAT tests because PCR there's not enough time, and the RAT test turned negative, and during the compassionate visit they could not take off their masks or give any food to the patients. And after that visit, the family follow our instructions to do a PCR tests, and the PCR test turned out to be positive. And once we know those results, we run a test on the patient, and it turned out positive as well. So we get all the other patients in the same ward tested, and out of that ward, 3 patients were eventually tested positive. And from what we know now, this is the situation. But we have to do more tracking and investigation to ascertain the transmission links between all these patients within the ward, because we know there are some visiting arrangements for the particular ward, but those visits should be special visits. Usually before the visitors come, they have to have a testing result that is within the last 48 hours. And before the visits, we try to communicate with the family, and we also getting the staff who have been to the ward tested, so as to identify the sources of the infection. And we are constantly in touch with Wong Tai Sin Hospital to know more about the situation. And some journalists also asked whether for those special visits there should be more RAT tests being run, and I want to draw a line between special visits and compassionate visits, because for compassionate visits, it's usually quite an emergent situation, because the patient's situation may be worsening very quickly, so we may make some leeway for compassionate visits. But during the compassionate visit, we would do all the measures we can to contain any risk for infection. So if anyone is going to special visits or compassionate visits, please do RAT test in advance to protect yourself, your family, the staff, and all the others involved. Next question, please. The gentleman on the right. AM 7:30. Question was asked about the painkillers being given to those getting jab of 3 years of age or below. Can you tell us more about that, and about the Wong Tai Sin Hospital cluster? How many patients were in that particular ward, and were the patients being right adjacent to the deceased patient? And how many families were infected because of the compassionate visit? It's the first time there are infection coming from compassionate visit. And Dr. Lau, you said about the 450 patients being transferred to private hospitals. They are not COVID-19 patients. And can you update us today how many of the 450 patients are COVID and non-COVID? And for designated clinics, are they still on great demand once the teleconferencing diagnosis is now in place? I just want to know about the alternative methods of diagnosis and designated clinics, and about the patients. A few patients you mentioned, did they faint at home or did they have any accidents at home beforehand?
About vaccination for children below the age of 3, if the child had been infected before and then after receiving after a wait of 3 months, the child could get the Sinovac jab, or in 1 month get a BioNTech jab. And if the child had been infected before, then well, the same period applies. And actually, you will find the relevant chart on our website. About the 3 confirmed cases, I don't have the total number of patients in that ward, but I know that the 3 patients shared the same ward as the deceased, but I don't know the exact bed location, so I can't answer your question right now. Yesterday, the incident came to our notice, and then we started investigation and tracing with a view to establishing any link, if there is any link among cases. As for private hospitals, I didn't make myself clear yesterday. In fact, the 40+ patients transferred to private hospitals are all non-COVID patients, but starting today, we have also transferred some COVID patients to the Chinese University Hospital. And I mean, at the moment, 1 COVID patient has been transferred to the CHK hospital. We hope that more patients can be transferred to private hospitals so as to make more beds available for us to receive COVID patients. And well, when we talk to some patients about transfer to private hospitals, some patients express concerns probably because of fees and charges, but they've been reassured that even after they've been transferred to private hospitals, they would only be charged the level of fees applicable to public hospitals. So I urge patients to cooperate with us as well to receive further treatment in those facilities. Next question, designated clinics. Just let me check. About 50 or 60% of quotas have been utilized in these designated clinics. So members of the public can make appointments with the designated clinics. If you use HA Go app, however, you may not be able to book an appointment instantly because quotas are released on an hourly basis. We don't want everyone to cram themselves in our system in the morning, so we phase it out on an hourly basis. And in certain peak periods, there tend to be more cases in our clinics. So if you can't make an appointment using HA Go, just come back a bit later, or you may try another designated clinic. Or, as I explained just now, for each clinic we have the respective telephone numbers, and may I rely on your good self to help us publicize the telephone numbers? You may ring the clinics, and I suppose some slots will still be available. As I announced earlier, only 60–70% of all the slots have been taken up. So we do hope the needy could seek help as quickly as possible. Now, what if the clinic is full? And what if I don't want to go to somewhere far away? Then you can try teleconsultation. Just make a booking and stay at home. At this stage, we don't intend to impose a quota, but if you make an appointment, you can have teleconsultation service from our doctors, and it's really convenient. As per the feedback from our users, the response is really positive. And about the 2 deceased cases, the family members of these 2 deceased patients found them unconscious at home, not because of accident, really. And in fact, one day before arriving in the hospital, one of the patients tested positive via RAT. Despite feeling unwell, the patient did not seek medical help or drugs there and then. As for the other case, a few days before the patient passed away, the patient tested positive and was given oral antiviral drugs. According to the family members, the patient was confused, and then the patient fell down, and the ambulance was called, and then the pulse was checked. There was no pulse, and on arrival at the A&E, resuscitation was administered, but in vain. So the patient passed away. Right, I'm sorry. A 94-year-old patient. That's the case I just referred to. Let me repeat. Just the day before she had passed away, she tested positive by RAT. She continued to stay home, but by the time her family members found her on the floor, she was unconscious. The other patient was a 92-year-old male patient, and like I just explained, a few days before he passed away, he tested RAT positive, and it also reported his case to the Department of Health. He was prescribed with medicine, but because of his other ailments and because of his senior age, he had a fall at home. Well, I'm not sure whether he fainted and fell or otherwise. There is no detailed account here. But anyway, after departing from our A&E unit, the case would be taken to the coroner's, the public mortuary for autopsy. I'm from cable TV. First, the number of confirmed cases exceeded 500 today. Is there any consideration to tighten the social distancing measures? Second question, now that a cluster has been identified in a ward under the compassionate visit arrangements, will the authority consider tightening the visit arrangements? Third question, starting today, a 6-month-old babies can get jabbed. Do you have the statistics of inoculation at the moment? Fourth question about the deceased. The male patient reported the case to the Department of Health and received medicine. What was the doctor's assessment at the time? Why wasn't he recommended to be admitted to hospital? Why was he staying home, leading to his passing away?
So because the epidemic is worsening, so we appeal to citizens to stay on alert. We're worried about the burden on our healthcare system as well. But the government currently has no plan to tighten the COVID measures. And for the numbers for getting jabs for 3 years of age or below, I don't have the number of me now. And for the Wong Tai Sin Hospital situation, for that, I'm really not sure right now whether it's caused by the so-called compassionate visit, but the situation is just after the visit, they get tested, and they tested positive, and the deceased patient also tested positive. So that's the facts we have right now. But as you rightly pointed out, for those who should go to who went to those visits, they are also part of the community, and there may be some hidden transmissions coming from those who went to the visits. And even after rounds of tests, they may be still tested negative, but they may be already carrying the virus. So for those who have gone to those special visits, or for the caretakers for children at the hospital, we have tightened the monitoring for all these involved persons. For example, the fathers who went into the ward to witness the laboring process, we all require all these persons to have negative tested results for less than 48 hours. So I would like to reiterate, these groups include the fathers who went for the laboring process, or the caretakers for children, because these persons are in touch with the vulnerable groups, and so we have to pay particular attention to them. As for whether these compassionate visits would be taken away, would we stop these measures? I would like to re-emphasize the purpose for compassionate visits is to allow the families of some emergent situations for the family to go see the patients before anything worse happen to those patients. So we recognize in Chinese traditions they really value these precious times with their family. So for now, we still consider if these compassionate visits allow, usually the CT value is rather low, and so we currently still rely on all the tracking and testing mechanisms post-visit to try to contain any risks that would stem from the compassionate visits. Speaker is off mic. I do not have the information about the patient's visit to the doctors. I only have the information from the A&E ward, and I know the patient has taken prescribed medicine, and based on the doctor's assessment at that stage, the doctor considered appropriate for the patient to go back home for quarantine. But I'd just like to emphasize the situations for especially chronic disease patients or elderly. Their situations can change very drastically in a very short period of time. So we really have to closely monitor their situations. And if anything changes, we really have to consult doctors and send them to the emergency wards if needed. From Ming Pao. Just want to ask a question about the 94-year-old female patient, that deceased patient. Is it the first time a cluster is caused by so-called compassionate visits, and how many family members were infected in that cluster? So is it right to say there's currently no plan to tighten the control for these compassionate visits or to stop these schemes? Or so that 94-year-old female patient, how did she get into hospital in the first place? What were the diagnosis? And then another question. So hospital authorities said in the radio interview now, so they have children patients who went into ICU. Does it include the 3 cases that went into ICU? Did they have any serious complications? And what kind of treatment are they being have they undergone? And in the past few days, how many children of 3 years of age or below have been treated? And is the number for this particular group on the rise recently? I really can't recall the questions you have asked. I'm sorry. For compassionate visits, we do not have any plans currently to stop this arrangement. So try to fit in their shoes, and if our family is in such an emergency situation, we would want to see them ourselves. So we just have to make sure if we go to these visits, we have our masks that fit our face correctly, and then we don't eat at during those visits, and we do not do anything that contravene the COVID measures. So, and we also have to do RAT tests, and PCR tests would follow as well. And when all these things are done, we believe the compassionate visits are still feasible, and currently we cannot point to an exact causation between these compassionate visits and the cluster that came from it. So we do continue to do our work in terms of tracking, investigation. And you mentioned about 3 cases. I don't know exactly which 3 cases you're referring to, but one of them should be in the Eastern Hospital, the 22-month-old baby girl, and another, a few 35-month-old a boy in PMQ, Princess Margaret Hospital, and also a 17-year-old boy, and there are some paralysis in the brain for that boy, 17-year-old patient. And what are the rest of your questions? I can't remember. As I have said, I cannot say the cluster is caused by the compassionate visits. We do not have numbers about, like, if compassionate visits have anything to do with the outbreak in those clusters. But just like every other visit, there's risks in every time you do a visit. So especially when you can see the number of cases is on the rise. So the virus in the community, there are also some patients who carry the virus who are not yet identified. So what we are doing now is to try to prevent the virus from going into the hospitals, but we cannot say anything about whether the compassionate visits caused any outbreak. So one family member out of that 94-year-old patient clustered has tested positive by a PCR test, and for other family members from that group, we don't have any further information yet. So this is the end of the press conference. Thank you very much.
Yes, you can put it this way, but we can't tell the source of transmission or the direction of transmission from whom to whom. Time-wise, we can't ascertain whether one gets infected right after the visit the previous day. I understand where your question comes from, but we can't say anything without accuracy. We need to do it with precision. So that's why at this moment I say we're not sure about the source of infection or the direction. The key is that we need to be careful about visits. We need to tighten the requirements when you go to the hospital for a visit. We require RAT tests to be conducted together with a stringent anti-epidemic measures because it is possible for virus to be brought into the hospital and further infect other patients through these visits, and we would like to minimize the risk. I'd also like to supplement as well. Just now, a reporter asked about children below the age of 3 who have got jabbed. By noon, 92 such children have been jabbed. The speaker is not coming through. That's right. Thank you.